Video is going to finish the muscles of the back and the trunk. So to start off, we'll begin with the Erector Spinae group. The Erector Spinae group is composed of three muscles, the Spinalis, Longissimus, and Iliocostalis. This group of muscles is primarily responsible for extension of the spine, but it also contributes to lateral flexion and rotation. And as a group, they're kind of our predominant spinal muscles. Starting with the spinalis originates on the spinous processes of the upper lumbar and lower thoracic vertebrae, as well as the ligamentum nuchae and the spinous process of C7. So it's important to remember with these muscles that they are separated into groups. So we have the Spinalis lumborum, Spinalum thoracis, and Spinalum cervicis. So Spinalis lumborum is the very small couple that are down in the lumbar spine, and then Spinalis thoracis and Spinalis cervicis. So for the lumborum section, they originate on the spinous process of the upper lumbar vertebrae, and then the thoracic section originates on the lower thoracic vertebrae, and then the cervicis originates on the ligamentum nuchae and the spinous process of C7. The thoracis inserts onto the spinous processes of the upper thoracic, and the cervicis inserts onto the spinous processes of the cervicals except for C1. Three sections of the longissimus are the thoracis, and then we have the cervicis and the capitis that exist up in the cervical spine. The section here down at the bottom is what we call the common tendon, and that's the common tendon for all of the erector spinae, and it's consistent with the thoracolumbar fascia. The longissimus thoracis originates from the common tendon, and the longissimus cervicis and capitis originate from the transverse processes of the upper 5 thoracic vertebrae, so T1 through T5. The thoracis inserts on the lower 9 ribs in the transverse processes of the thoracic vertebrae. The cervicis inserts onto the transverse processes of the cervical vertebrae, and the capitis inserts onto the mastoid process of the temporal bone. The three sections of the iliocostalis are the lumborum, thoracis, and cervicis. So the lumborum is this section down here, and we have thoracis and the small section of the cervicis at the top. The lumborum originates from the common tendon, just like we saw with our longissimus. And then thoracis and cervicis originate from the posterior surface of ribs 1 through 12. The lumborum inserts onto the transverse processes of lumbar vertebrae 1 through 3 and the posterior surface of ribs 6 through 12. Thoracis inserts on the posterior surface of ribs 1 through 6, and cervicis inserts on the transverse processes of the lower cervicals, so C4 through 7. So again, the erector spinae group is responsible for lateral flexion, rotation, and extension of the spine or the vertebral column at each segment, and it's innervated by the dorsal primary divisions of the spinal nerves. The multifidi, or the individual multifidus muscles, are responsible for rotation of the vertebral column as well as extension. The multifidi, or multifidus, if it's individuals, originate from the sacrum and the transverse processes of the lumbar through the cervical vertebrae, and they insert on the spinous processes of the lumbar through the second cervical vertebrae, and they span anywhere from 2 to 4 vertebrae depending on where they're located. They're innervated by the dorsal primary divisions of the spinal nerves, and again they cause rotation and extension of the spinal column, as well as lateral flexion. The rotators originate from the transverse processes of the lumbar through the cervical vertebrae as well, and they insert as well onto the spinous processes of the lumbar through the second cervical vertebrae, and they span 1 to 2 vertebrae. It's also important to note that through the thoracic spine, some of them have multiple muscles off of the same spinous process, or transverse process, excuse me. So if we look like right here, you can see how there's 2 muscles off of each transverse process going to the next up spinous process, and then 2 up spinous processes, so they kind of create this V shape. They cause rotation, lateral flexion, and extension of the spine, and are innervated by the dorsal primary divisions of spinal nerves. Semispinalis capitis originates on the transverse process of the thoracic vertebrae as well as the articular processes of the lower cervicals, and inserts on the spinous processes of the upper thoracic and cervical vertebrae except for C1, as well as the nuchal line of the occiput. It's innervated by the dorsal primary divisions of the spinal nerves, and it works to extend the spinal column and the head. Quadratus Lumborum originates on the posterior iliac crest and inserts on the last rib and the transverse processes of the first through fourth lumbar vertebrae. It's innervated by branches of the first lumbar and 12th thoracic spinal nerves, and it works to laterally tilt the pelvis, laterally flex and extend the vertebral column, and it also works to fix the last rib during inhalation with forced exhalation. The rectus abdominis originates from the pubic crest and the pubic symphysis and inserts onto the cartilage of the 5th, 6th, and 7th ribs as well as the xiphoid process. It's innervated by branches of the intercostal nerve, and it works to flex the vertebral column. The external obliques originate on the lower 8 ribs and insert onto the anterior part of the iliac crest, the abdominal aponeurosis, and the linea alba. It's innervated by branches of the intercostals, and it works to laterally flex and rotate the vertebral column. The internal oblique originates from the lateral inguinal ligament, the iliac crest, and the thoracolumbar fascia. It inserts into the abdominal aponeurosis and the linea alba. It's innervated by branches of the intercostals, and it works to laterally flex and rotate the vertebral column, as well as flex and compress the abdominal contents. The transverse abdominis originates from the lateral inguinal ligament, the iliac crest, thoracolumbar fascia, and internal surfaces of the lower 6 ribs. It inserts onto the abdominal aponeurosis to the linea alba. It's innervated by branches of the intercostal nerves, and it works to compress the abdominal contents. This muscle is also a key stabilizer of the spine, but really doesn't generate any motion. There are 2 serratus posterior muscles. We have serratus posterior superior and serratus posterior inferior. Serratus posterior superior originates on the spinous processes of C7 through T3 and inserts on the posterior surface of the 2nd through 5th ribs. Serratus posterior inferior originates on the spinous processes of T12 through L3 and inserts on the posterior surface of the 9th through 12th ribs. Serratus posterior superior works to elevate the ribs during inhalation, and serratus posterior inferior works to depress the ribs through elevation, and then they both help with rotation of the spine. Serratus posterior superior helping with rotation of the thoracic spine, and serratus posterior inferior helping with rotation of the lumbar spine. Serratus posterior superior is innervated by spinal nerves 1 through 4, while serratus posterior inferior is innervated by spinal nerves 9 through 12.